Hi, this is Dr. Rajeshwar from YR Pharma Tube. In the previous videos, we learnt the male and female sex hormones. The links are given in the description below this video. Watch them. In this lesson, I would like to discuss the drugs used for erectile dysfunction such as Sildenafil and Tadalafil. From this lesson, you can understand the erectile dysfunction, the causes of erectile dysfunction, the physiological process of penile erection, and the treatment of erectile dysfunction using the drugs Sildenafil and Tadalafil. Introduction to erectile dysfunction. Erectile dysfunction, abbreviated ED, also called impotence. The Latin term impotentia coe undi describes a simple inability to insert the penis into the vagina. It is mostly replaced by more precise terms such as erectile dysfunction. It is a type of sexual dysfunction in which the penis fails to become or stay erect during sexual activity. It is the most common sexual problem in men. Through its connection to self-image and to problems in sexual relationships, erectile dysfunction can cause psychological harm. In about 80% of cases, physical causes can be identified. These include cardiovascular disease, diabetes mellitus, neurological problems such as those following prostatectomy, hypogonadism, and drug side effects. About 10% of cases are psychological impotence caused by thoughts or feelings. Here, there is a strong response to placebo treatment. What causes erectile dysfunction? The causes or contributors to erectile dysfunction include: number 1, prescription drugs such as selective serotonin reuptake inhibitors, beta blockers, alpha-2 adrenergic receptor agonists, thiazides, hormone modulators, and 5-alpha reductase inhibitors. Number 2, neurogenic disorders such as diabetic neuropathy, temporal lobe epilepsy, multiple sclerosis, Parkinson's diseases, and multiple system atrophy. Number 3, cavernosal disorders. For example, Peyronie's disease. Number 5, hyperprolactinemia, that is due to a prolactinoma. Number 6, psychological causes which include performance anxiety, stress, and mental disorders. Number 7, surgery, that is radical prostatectomy. Number 8, aging. It is 4 times more common in men aged in their 60s than those in their 40s. Number 9, kidney failure. And the last one is lifestyle habits, particularly smoking, which is a key risk factor for erectile dysfunction as it promotes arterial narrowing. Erectile dysfunction is a common complication of treatments for prostate cancer, including prostatectomy and destruction of the prostate by external beam radiation, although the prostate gland itself is not necessary to achieve an erection. Erectile dysfunction can also be associated with bicycling due to both neurological and vascular problems due to compression. The increased risk appears to be about 1 to 7 times. Concerns that use pornography can cause erectile dysfunction have little support in epidemiological studies, according to a 2015 literature review. Physiological process of penile erection. Penile erection is managed by 2 mechanisms. Number 1, the reflex erection, which is achieved by directly touching to the penile shaft. And number 2, the psychogenic erection, which is achieved by erotic or emotional stimuli. Stimulation of the penile shaft by the nervous system leads to the secretion of nitric acid, which causes the relaxation of the smooth muscles of the corpora cavernosa, the main erectile tissue of the penis, and subsequently penile erection. Additionally, adequate levels of testosterone, which is produced by the testis, and an intact pituitary gland are required for the development of a healthy erectile system. As can be understood from the mechanisms of a normal erection, impotence may be developed due to hormonal deficiency, disorders of the neural system, lack of adequate penile blood supply, or psychological problems. Spinal cord injury causes sexual dysfunction, including erectile dysfunction. Restriction of blood flow can arise from impaired endothelial function due to the usual causes associated with coronary artery disease, but can also be caused by prolonged exposure to bright light. The physiological mechanism of penile erection is mediated via an nitric oxide cyclic guanosine monophosphate pathway. Parasympathetic neurons and vascular endothelial cells release nitric oxide, which activates soluble guanylyl cyclase, increasing cyclic GMP. The cyclic GMP of the corpus cavernosum of the penis leads to relaxation of the vascular smooth muscle, increasing blood flow to the penis and penile erection. Metabolic hydrolysis of cyclic GMP is catalyzed by phosphodiesterase enzyme inhibition, of which results in a maintained erection. Treatment depends on the underlying cause. In general, exercise, particularly of the aerobic type, is effective for preventing erectile dysfunction during midlife. Counseling can also be used if the underlying cause is psychological, including how to lower stress or anxiety related to sex. Medications by mouth and vacuum erection devices are first-line treatments, followed by injection of drugs into the penis as well as penile implants. Vascular reconstructive surgeries are also beneficial in certain groups. Treatments other than surgery do not fix the underlying psychological problem but are used as needed before sex. Medications. Therapy for erectile dysfunction include penile implants, intrapenile injections of alprostadil, intraurethral suppositories of alprostadil, and oral phosphodiesterase 5, abbreviated as PDE5 inhibitors. Because of the efficacy, ease of use, and safety of PDE5 inhibitors, these drugs are now considered first-line therapy for erectile dysfunction. 4 phosphodiesterase 5 inhibitors, namely Sildenafil, Sildenafil Tadalafil, and Evenafil, are approved for the treatment of erectile dysfunction. It is to be noted that Sildenafil and Tadalafil are also indicated to treat pulmonary hypertension, although the dosage regimen differs from this indication. Coming to the individual drugs, the first drug is Sildenafil. Sildenafil was the first phosphodiesterase inhibitor to be developed to treat erectile dysfunction in men. It is famously marketed as Viagra. Sildenafil is a pyrazolo 4,3-D-pyrimidine 7-one having a methyl substituent at the first position, a propyl substituent at the third position, and a 2-ethoxy 5,4-methylpiperazine 1-yl sulfonyl phenyl group at the fifth position. It is a pyrazolopyrimidinone derivative structurally related to zaprinast with vasodilating and potential anti-inflammatory activities. The chemical structure of sildenafil is similar to that of cyclic GMP and acts as a competitive binding agent of phosphodiesterase type 5 enzyme, abbreviated as PDE5. It acts by blocking PDE5, an enzyme that promotes breakdown of cyclic GMP, which regulates blood flow in the penis. It requires sexual arousal to work. It also results in dilation of the blood vessels in the lungs. By increasing cyclic nucleotide levels, it relaxes the arterial wall, leading to decreased pulmonary arterial resistance and pressure. As a result of the selective distribution of PDE5 within the arterial smooth muscle of the lungs and penis, sildenafil acts selectively in these areas. It is also effective in the rare disease known as pulmonary arterial hypertension, abbreviated as PAH. Synthesis of sildenafil. The first step of the synthesis is the reaction of a diketoester and hydrazine to give the pyrazole ring. The regioselective N-methylation of the pyrazole using dimethyl sulfate followed by the hydrolysis using dilute sodium hydroxide gives a carboxylic acid. The carboxylic acid is then reacted with nitric acid and sulfuric acid to give a nitrated product. This is then followed by a carboxamide formation and reduction to the nitro group. The compound carboxamide is then acylated under basic conditions and this produces the pyrazolopyrimidinone. This is then chlorosulfonylated selectively on the 5' position of the phenyl ring. This can help couple with an amine to give sildenafil. Uses of sildenafil. Sildenafil is sold under the brand name Viagra, that is predominantly employed for two primary conditions. Number 1, in the treatment of erectile dysfunction, and number 2, treatment of pulmonary hypertension. Its effective is unclear for treating sexual dysfunction in women. It can be taken by mouth or injection into a vein. In the natural setting, that is with sexual stimulation, it restores impaired erectile function by increasing blood flow to the penis. The next drug is Tadalafil. Tadalafil is a potent phosphodiesterase type 5 inhibitor. It is chemically an annulated 2,5-diketopiperazine. It is also a 1,2,3,4 tetrahydrobeta-carbolin. Tadalafil is the only PDE5 inhibitor approved for the treatment of benign prostatic hyperplasia, that is BPH. The 3,4-methylene dioxy substitution on the phenyl ring is significant for increasing its potency as a phosphodiesterase type 5 inhibitor. Optimization of the chain on the piperazine dione ring results in no significant change in its IC50 value. PDE5 is present in the prostate and bladder. As such, inhibition of PDE5 by Tadalafil allows for vasodilation and relaxation of the smooth muscle of the prostate and bladder, which thereby improves the symptoms of benign prostatic hyperplasia. It is more potent and longer acting congener of sildenafil. Synthesis of Tadalafil. The synthesis involves three steps. In the first step, D-tryptophan methyl ester reacts with piperonol via Pictet-Spengler reaction. The resulting compound undergoes condensation with chloroacetyl chloride in the second step, and in the third step, cyclization takes place upon reaction with methylamine to form a diketopiperazine ring. Uses of Tadalafil. Tadalafil is sold under the brand name Cialis. It is used to treat erectile dysfunction, benign prostatic hyperplasia, and pulmonary arterial hypertension. This is the list of references. That's all in this video, the drugs used for erectile dysfunction. In the next lesson, we learn the oral contraceptives. Till then, never stop learning and never stop watching my videos. Thank you for watching this video.